welcome back to Veria Living Live. You know, today is the start of National Infertility Week. And Robin, did you know that actually 12% of women and men of reproductive age in the U.S. are affected by infertility?
I would believe that because I see it happening within my friends in different communities, in my wellness world, that people are starting to talk about it more. But I actually believe it might even be higher because I think people aren't talking about it enough, which is why I'm so happy that there now is an Infertility Week to get people speaking about it, and that we have such an incredible guest here today.
Because there's a certain stigma there that's associated with it. Well, we here at VLL, as we say, we love to connect with you and answer your biggest questions. Right now, it is time for a very special edition of Ask the Infertility Expert. Joining us right now is Dr. Thomas Molinaro. He is a reproductive endocrinologist from the Reproductive Medicine Associates of New Jersey. Dr. Molinaro, thank you so much for being here.
Thanks for having me.
Appreciate it very much.
Yeah, we're really excited to be talking about this topic. And tell me, why do you think it is important for couples to talk about fertility issues with each other or even with their doctors?
You know, I really think that infertility is one of those conditions where people are just afraid to talk about it. You know, it's hard for couples who are trying to get pregnant when it's not working, and they go to parties or family functions, and everyone's asking, when are you going to have a baby? And so it's sort of like pouring salt in the wound. So I think, you know, the whole purpose of National Infertility Awareness Week is to get infertility out into the open and tell people that it's more common than you think, and that there are good treatments out there for you. And I think that's a really big part of it.
All right. Well, very good. Well, we have a viewer question right now for you, Dr. Molinaro. So let's take this call here. It's Renee in Schenectady, New York, on the line. Hello there, Renee. How are you?
Hello. I'm good. How are you?
Very great. What's your question for Dr. Molinaro today?
My question is that I'm 30 years old, and I would like to wait a few years to have kids, but my fiance wants to start now because of our age. And I've considered freezing my eggs in case I do have infertility issues when I'm 35, 36. Would you recommend doing that?
Well, I think that's a really great idea. You know, the whole purpose of freezing eggs or embryos is to preserve your fertility. And the reason why we think it's important is that women don't make new eggs. You're born with all of your eggs, and as you go through life, you're using them up. And eventually, you'll run out of eggs. That's menopause. You know, we know that as you get older, though, it's not just a quantity phenomenon, it's a quality phenomenon, too. And so older eggs don't work as well. They're not as efficient. They're more likely to give you chromosomal problems in the pregnancy. And so women who are in their late 20s, early 30s, thinking of deferring childbearing, it's a great option to put some of those eggs into the freezer. It will give you more, a greater ability to get pregnant as you come back and try. I mean, I think there are some important things to consider. Number one is go see your fertility expert right away. You know, try to get some of the early testing done so we can figure out the quality of the eggs that you have now. And when you're picking a fertility center, really look for centers that are high quality, high tech, really pushing the cutting edge of this technology, because there's a lot of differences from one IVF center to another. Our center at Reproductive Medicine Associates of New Jersey, we work really hard at improving what happens in the IVF laboratory. And part of that is freezing eggs. Yeah.
All right. Awesome. Well, Renee, we hope that helps you out. Thank you so much for that question today. Moving on to an email question now from Andrea in Richmond, Michigan. Andrea says, my husband and I are both 33 and have been trying to get pregnant for a year. We just found out that my husband has no swimmers. Is in vitro fertilization an option if he is sterile?
It's a great question. So I think, you know, men are a little bit shy, a little bit embarrassed about providing a semen sample, but about a third of couples with infertility have a male factor. There are lots of great treatments for male infertility. If he, in fact, has no sperm in his sample at all, it doesn't mean that he's not producing sperm. Sometimes the sperm are just found higher up in the system. So we can do a procedure where the sperm are actually harvested surgically, and then we use those sperm in the IVF laboratory. And, you know, honestly, this couple, they're young, they have a really great prognosis, but they should, you know, get out there and see fertility experts who know what they're doing.
Awesome. There is hope, absolutely. Well, before we go, one more question. This one comes from Julie on Facebook. Julie says, I heard that acupuncture could help my chances of getting pregnant. Is this true? I'm fascinated to hear this answer.
Yeah, I've heard a lot about this as well.
Right. So it's interesting. At RMA, we did a study a few years back where we showed some modest improvement in IVF success with acupuncture, and an additional 3 to 5% success just with using acupuncture right around the time of the cycle. I think one of the focuses of our practice is really to treat the whole patient. So not just the science and the medicine, but also the whole mind-body connection.
I love that.
Right.
So we use acupuncture, we use yoga, we use nutrition counseling and psychological counseling to try to improve the whole patient, really treat her from top to bottom. And at the end of the day, I think success rates are improved by every little bit that you do.
That's wonderful to know.
Yeah.
So it sounds like you have options. You just need to find out what they are
Yeah,
and talk
totally.
to the professionals.
That's great to hear. Well, Dr. Thomas Molinaro, thank you so much for being here today. Really appreciate it. Yeah, not at all. Sure. All right, well, up next, all month long, we're revealing...